Food allergy is one of the biggest concerns parents have during complementary feeding, and that concern is legitimate. Food allergies are real, they can be serious, and the number of diagnosed children has been increasing over the past decades. But there is a problem in how many parents approach this fear. They know how to recognize the most obvious signs, like facial swelling or breathing difficulty. What most do not know is that there are more subtle signs, ones that show up before the severe signs, and that are often confused with something else, like colic, irritability, or simply a phase the baby is going through. During complementary feeding, which is recommended to continue until 2 years of age, it is essential for parents to know how to identify signs of allergy in all their forms, from the mildest to the most severe, so they can act at the right time. In this video, you will learn 5 signs of food allergy that parents often overlook and why paying attention to each one can make a real difference. If you want more content like this about baby nutrition, subscribe to the channel. We publish every week. Now let's get into it. Number 1. Skin changes that are not immediate. When parents think about an allergic reaction, the image that usually comes to mind is a fast, visible reaction. The baby eats the food, and within minutes, clear red marks appear. That type of reaction exists, and it is important to know how to recognize it. But there is another kind of skin manifestation that is just as relevant and far more often ignored. Changes that show up hours later, or that develop gradually over days. Eczema that worsens after the introduction of a specific food, unusual dryness of the skin, redness around the mouth that does not go away, or small rashes that come and go without an obvious explanation can be related to a food sensitivity that does not show up in the classic immediate way. This type of reaction is called a non-IgE-mediated reaction, or delayed hypersensitivity reaction. Unlike the classic allergic reaction, which involves an immediate immune response, this type develops over hours or days and is harder to directly link to a specific food. What to do in practice? Keep a simple log of newly introduced foods and watch the baby's skin over the following days, not just the following hours. If you notice a pattern of skin flare-ups associated with a specific food, even if the reaction is not immediate, talk to the pediatrician. This kind of information is valuable for diagnosis, even when there is no obvious acute reaction. Number 2. Changes in stool patterns. A baby's stool naturally changes during complementary feeding. This is expected and normal, but there are specific patterns that go beyond normal variation, and that can indicate an allergic reaction or food intolerance. Blood in the stool, even in small amounts and even if the baby seems otherwise well, is a sign that should never be ignored. This symptom is associated with a condition called allergic proctocolitis, more common in babies sensitive to cow's milk protein, but it can occur with other foods as well. Persistent diarrhea that starts shortly after the introduction of a new food and does not improve over the following days also deserves attention. The same applies to stool with visible mucus, recurrently very loose stool, or a sudden change in bowel movement frequency that coincides with the introduction of a specific food. Many parents attribute these changes to a stomach virus, a passing issue, or simply the digestive system adjusting to new foods. In many cases, that is exactly what it is. But when the pattern repeats consistently after offering a specific food, it is important to consider the possibility of a food reaction and report it to the pediatrician. What to do in practice? Watch for a time relationship between the introduction of a food and significant persistent changes in stool patterns. Blood in the stool should always be reported to the pediatrician, regardless of any other symptom. Number 3. Irritability and excessive crying after meals. This is perhaps the most frequently misattributed sign on this list. The baby cries a lot after eating, becomes irritable, seems uncomfortable, and parents often interpret this as colic, a developmental phase, or simply the baby's temperament. In some cases, that is exactly what it is. But in others, this pattern of irritability can be a sign of gastrointestinal discomfort related to a food sensitivity. Babies cannot verbalize abdominal pain, bloating, or digestive discomfort. The only way they have to communicate it is through crying and irritability. The detail that distinguishes a concerning pattern from common colic is time consistency. If excessive crying happens repeatedly after offering a specific food, and does not happen the same way at other times, this is a relevant clue. Common colic usually does not show such a consistent pattern tied to a specific food. Other signs that can accompany this picture include the baby arching their back during or after meals, abruptly refusing to keep eating even though they seemed hungry moments before, or visible abdominal bloating after eating a certain food. What to do in practice? Watch for a pattern between irritability and a specific food. Note mealtimes and moments of intense crying. If a consistent pattern emerges, report it to the pediatrician with as much detail as possible about what was offered and when the discomfort began. Number 4. Difficulty gaining weight with no apparent cause. This is one of the most serious signs on the list, and at the same time, one of the most subtle, because it does not show up all at once. It develops over weeks or months, and is often only noticed at routine checkups, when the pediatrician sees that the baby's growth curve is not following the expected pattern. Undiagnosed food allergies and intolerances can lead to nutrient malabsorption. The baby's intestine, responding to inflammation caused by the food reaction, partially loses its ability to absorb nutrients efficiently. The result is that even if the baby seems to be eating adequate amounts, they are not gaining weight or growing at the expected pace. This picture is usually accompanied by other signs on this list: skin changes, stool changes, irritability. But in some cases, difficulty gaining weight can be the most evident sign, especially when the other symptoms are mild enough to go unnoticed. What to do in practice? Bring your baby to regular well-child checkups and pay attention to the growth curve. If the pediatrician points out a slowdown in weight gain without an obvious cause, mention any other symptom you have noticed, even if it seems minor or unrelated, such as skin or stool changes. These details help the pediatrician investigate the cause more precisely. Number 5. Sleep patterns that worsen without explanation. A baby's sleep is influenced by many factors, which is why this sign is one of the hardest to link to a food cause. But there is a real relationship between gastrointestinal discomfort caused by food sensitivity and the quality of a baby's sleep. When a baby has an allergic or intolerance reaction that causes digestive discomfort, reflux, or abdominal bloating, that discomfort often worsens when the baby is lying down, which can lead to frequent night wakings, difficulty falling asleep, or a sleep pattern that was previously stable and began deteriorating without an obvious cause like teething or a developmental milestone. The key point here, again, is the time pattern. If the worsening sleep coincides with the introduction of a specific food or with an increase in the amount of a food already introduced, it is worth investigating that relationship. If the worsening sleep is isolated and has no apparent connection to food, it is more likely caused by something else, like teething, a developmental leap, or a typical sleep regression for that age. What to do in practice? When you notice a persistent, unexplained worsening in your baby's sleep, consider their recent food history as part of the investigation. Combine this observation with the other signs on this list. When several signs appear together and follow the same time pattern relative to a specific food, the likelihood of a food reaction increases significantly. None of these signs alone necessarily means a food allergy. Each one can also have other completely normal explanations unrelated to food. What matters is not panicking over each isolated symptom, but paying attention to the pattern, repetition, time consistency, and the relationship between the sign and a specific food. Skin changes that are not immediate, changes in stool patterns, excessive irritability after meals, difficulty gaining weight with no apparent cause, and worsening sleep patterns without explanation. 5 signs that deserve attention, and that, when identified in time, allow the pediatrician to investigate and guide the family before the situation gets worse. The description of this video has a free guide with the complete first-year feeding plan, what is safe, what to avoid, and when to introduce each food. Just click and download. In the next video, we cover how to introduce allergenic foods safely, step by step. See you then.